Hi, so today I'm going to talk about Mr. Hansen's case. He's a 58-year-old male who's been diagnosed with ALS, and he's experienced speech and swallowing problems within the past year. So the analysis used a sample that was conducted in a quiet, probably soundproof room, and it consists of sustained phonation, connected speech, diadochokinesis, and cough sequences. So a summary of the results is several measures of the acoustic measures were within normative limits for the participant's age and gender. However, many measures such as voice quality and articulation were outside of the normative limits. So this table summarizes the results. We can see that his fundamental frequency and jitter from sustained phonation fall within the normative range. However, shimmer is elevated and H&R is reduced. So this can often indicate a breathy or hoarse voice quality. His connected speech measures show his fundamental frequency, pitch sigma, and average intensity are within normative limits as well. So to check the voice quality from a perceptual observation, he definitely has a breathy voice, and there's also an indication of hypernasalization and inaccurate slurred articulation, especially with consonant sounds. So the acoustic and the perceptual measures do seem to meet up for the breathy voice consonant quality. So now we'll move on to look more at the vowels and consonants in his articulation. So his formant analysis of the sustained ah fell within normative limits, and nasalization for nasal consonants was within the normal measures. However, there did appear to be hypernasalization on his spectrogram for voiceless consonants. And from the spectrogram, the voice onset time was not clearly present between voiceless consonants and voiced vowels. So he did not have an absence of voicing before the voiced vowels occurred. And fricatives were also not within normative limits because they had nasals present, and the dark formant bands were at much lower frequency than would be expected. There was no greater than 4,000 hertz cluster of energy. However, his MPT did fall within normative measures. So moving on to a spectrogram that illustrates some of these results and also will connect them to some interpretations, we can see that this sentence the participant repeated does not contain any nasal consonants, and it consists of voiceless consonant, voiced vowel, voiceless consonant, voiced vowel. So you would expect to see no nasal murmur and the presence of a vertical white line showing voice onset time. However, we have a clear nasal murmur here, less than 500 hertz. Also, there's no indication throughout the spectrogram of voice onset time because the nasal murmur is voiced. So everything the participant all of the participant's speech does have the presence of voicing. He's not able to articulate voiced consonants. As for fricatives, they clearly have the nasals present, and the energy is not at very high, clustered at high frequency levels that we would expect. It's at much lower frequency levels. So this is all atypical, and it illustrates that our acoustic data and perceptual observations do match. He has a breathy voice quality, and his speech is hypernasalized with inaccurate articulation of consonants. So the hypernasalization is a big key in the fact that his consonants are not articulated correctly. And this is due to his ALS diagnosis, which is a neuromuscular disorder. So he is unable to close the velopharyngeal port to prevent acoustic energy from entering the nasal cavity. And there it often gets damped, which is why his fricatives are at much lower frequencies. So he probably has poor muscle control of muscles in the oral and pharyngeal cavity. Also, the breathy voice quality is related to inefficient adduction of the vocal folds, also probably because he has poor muscle control there as well. So to summarize, these results are very much related to his ALS diagnosis.